Well, hey everybody, this is Dr. Bulow, and I'm here with Dr. R.J. Skalos.
Good morning.
Is it
that is correct,
right?
yes, that is
fantastic. And he's here with Windrose Animal
Yes.
Hospital, right?
That is correct, yes.
And I just thought, first of all, I think it was one of your clients or someone that got me in contact with Dr. R.J. And he's right on the way to work, so I thought we got connected, and I said, we're stopping by. I have a couple of my kids with me, and my one wants to be a vet like every child who's got a puppy. And I thought, well, this would be kind of cool. We got to go and get to chat with you, see this space. To be fair, I've been chatting with RJ a little bit. I usually go live right away. But why don't you introduce yourself to your clinic to the folks, and then we'll get some questions answered.
Absolutely. So my name is Dr. RJ Skalos. This is my hospital. It's Windrose Animal Hospital. We opened roughly about 18 months ago, so in June of 2016 is when we officially opened. Yep. We are a primary small animal care facility, so dogs and cats pretty much exclusively is all we see.
Oh, okay.
Really, our goal here is how we differentiate ourselves is we are all service over product. We really put a lot of time and effort into the exam when you come in, answering your questions, discussing those different hot topics, anything from vaccines to foods. I mean, the canine flu right now is like an everyday discussion that way.
Interesting.
So that's really where one aspect of what we do to differentiate ourselves. And then the other thing is that we really try to leverage technology to the utmost to make your guys' life easier. We have an online pet portal so you guys can schedule on your own that way. I have a texting service after hours. Like literally you can hit me up anytime between 8 a.m. and 11 o'clock at night, and I'll get right back to you as soon as I see the text kick
That's
through.
Very nice.
That way. We have an online pharmacy. I have a whole bunch of different ways in which we try to make life easier for you guys as well.
Cool. Yeah, it's being professional in the 21st century, right? All
You
the
got it.
Technology and everything. Now, that was one thing I got along with RJ with, is he was mentioning how in your hospital here, there's not a whole bunch of extra ancillary things that you sell, and you kind of one-offs and one-ups and all these different things. And I know in our clinic, we're the same way. We really kind of brand and position ourselves with just high value, quality time with our patients.
Correct.
And I think
Yes.
you had mentioned that your appointments are something like a half-hour appointment instead of like 5 to 10 minutes.
Yes, exactly. Every one of our routine appointments, so it'd be either your annual exam or if it's a medical problem, are just set at a half an hour. So again,
That's
we're
Yeah.
really trying to take the time with you to answer your questions. My goal is to never have anybody feel like they're being rushed when they're here in hospital.
Yeah.
And even when we get backed up, and that does happen, emergencies happen.
Yeah.
One of my own personal pet peeves is having to wait around. So we do our darndest to keep everybody on a nice, even pace. That way, keep everybody informed. Nobody sits up in the lobby if, God forbid, we do fall behind.
Yeah.
We keep everybody informed. You're not just going to sit up there for extra 20 minutes and have no idea why that's happening. So.
My wife is our operations manager at our clinic, and she actually was always very on top of that. Like if we were running behind, she would even want our staff to call someone and say, "Hey, Doc's running behind. If you guys want to come in 15 minutes later, that'd be fine."
Yeah.
Just because, I mean, everyone knows what that's like. I think sometimes in large hospital settings, it becomes so much systems that you're so far removed from the people that govern it that the systems take over in spite of the people.
Right.
You know what I mean?
Exactly. Yeah.
But speaking of that, I think that's interesting. What I learned from Dr. RJ here is that you were an ER doctor.
That is
right?
correct. Yes.
Very cool.
Yeah. So actually, I'm actually what's called a Ross University alumni. So I went to school down in St. Kitts in the Caribbean. We are an AVMA accredited school.
Oh, cool.
So I just did all my book work down there, and then clearly because there's not enough caseload down there, we then get farmed out to the stateside schools. I finished at the University of Minnesota. I then did postdoctorate training at a facility called Bulow Veterinary Partners.
Gotcha.
So that was a 1-year intensive study. I worked with only specialists that way. And then I did ER for about 4.5 years.
Yeah.
And I've always wanted to own my own practice, which is kind of how this came to be. In the ER world, there really wasn't a room for another one. There's plenty of them in this area already.
Yeah.
So I spun off and jumped ship and became a general practitioner, and that's how this all came.
Now, who's this?
This is Ellie Mae. You might hear clicking around.
Oh, hold on. We're going to go down. Everyone's got to see Ellie Mae.
Say hi, Ellie. She's over there. Ellie Mae. Nope.
That's all right. So that's Dr. RJ's rescue dog, she's a sweetheart. And it looks like your niece and nephew say hello. So this is kind of fun. Well, here's what we're going to do. I'm going to get a tour of the facility. Doc's going to show us around. And then if you're watching this later on or live, please feel free to ask questions. Looks like Mr. Bobby. No, wait. That's a picture. Oh no, this is my own message. Sorry, Miss Bobby. There we go. Ellie made sure to get on the camera. Yeah, sorry about that. I had a message come up on my phone the same time you messaged there, Bobby. But yes, Ellie did want to get a little FaceTime. She's playing with my girls. She's awesome. So yeah, we're going to get a tour of the facility. I can't wait to check it out. And I mean, first impressions when I first came in, it was really welcoming and very professional and very nice. That's something, again, as a clinical owner and entrepreneur, it's important to me. And maybe, well, we'll kind of work our way backwards. We're in the back now, so you guys get a behind the scenes tour. And like I said, what I was saying before is, if you have any questions, please ask them. And if you're watching this back later, go ahead and ask, and I'm sure you'll get in on the comment section and answer folks' questions. So I'm going to step around behind the camera, and I'm going to let Dr. RJ kind of take us around the facility. So let me just switch this around. All right, so yeah, we're in the behind the scenes. There's Ellie Mae again, and hanging out with her papa there.
She's usually hidden upstairs in the doctor's office. She just gets to wander this morning.
That's
We're not
right.
seeing any patients yet. So
That's all right.
yes, this is our back area. This is the big, scary behind the white door. I swear, people, there's nothing we're hiding back here.
That's
overall.
right.
That way. This is a pretty typical setup you're going to see in most facilities. Over here, where you can see here, this is what's called a wet table. So this is like where we do our dental procedures and things along those lines. Or if we need to do a medicated bath or anything like that, just a nice open table with drains and everything set up overall. It's also where we typically draw blood and whatnot if needed. Kind of have everything quickly within arm's reach. So kind of the brain or the hub of the entire practice that way.
Gotcha.
As we slip over this way behind everybody, you'll see here, this is actually our surgical prep area that way. This big behemoth right here is actually what's called an ultrasonic, or not ultrasonic, excuse me, an autoclave. This is how we sterilize everything, and the same with this goes along with it. It's an ultrasonic cleaner. So we follow all of the same protocols that are set forth, pretty much even on the human side. Everything gets hand scrubbed, sterilized, then goes through an ultrasonic cleaner, then autoclaved. Again, everything is held to the highest standard overall.
What are your most common surgeries that you do with the dogs and the cats? There, the spade and neuter, or
I would say probably our top three are spade, neuters, dental procedures, and probably mass removals. That way, we have had a couple of bladder surgeries and some other more involved procedures that way.
So the spaying and neuter obviously is probably something that we all should be doing. When it comes to the dental, are there things people can do to kind of prevent the need for it? Like, what are some healthy tips? I mean, I just as a dog owner and as a conservative chiropractor, and I know you yourself, are like the preventative is obviously where it's at. So, what are some tips you would give to folks in terms of how to avoid needing that?
It's the most difficult thing, but it's just like with you and I, and this is what I tell every client, nothing beats brushing the teeth. Ideally once a day.
Even the dog, brushing the dog's teeth?
Even the dog. So, as people, we get cavities. Dogs typically get what's called tartar and calculus development overall. Either way, it starts to eat away at the tooth overall, and the best way is to knock that off in the process so it can't sit there and kind of erode away. Is
there like a special toothbrush you buy, or just anything at the pet store?
Actually, anything at the pet store. There's finger toothbrushes. There's small ones. You can even use human toothbrushes for normal adult toothbrushes for like larger breed dogs. There are a couple of different products that have come to market because a lot of people either don't have the time or forget. Guilty as charged, even though I'm a doctor. I will not get her teeth cleaned every day. Again, I try my best that way. And that's where there's like water additives and sprays and some chews, and a lot of those actually will work very nicely. They're not a complete replacement, but it's better than doing nothing at all.
Those would be those little green ones, right?
Yeah, so there's a whole bunch of different products on the market now.
Got it.
In particular, what I usually tell people is follow what's called the VOHC, or the Veterinary Oral Health Council. This is kind of the veterinary dentist, specialty dentists that have looked at the products and say it does what it's supposed to do. So you know that you're not buying kind of a not a good product, basically.
Cool. So, awesome. I appreciate that. And if anyone has questions, I'm just going to ask my own questions as a cat and dog owner. But if anyone else has questions, go ahead and ask Dr. RJ.
Lab area here. Again, we keep things pretty simple, easy peasy. We can do what we need to in-house to get to a diagnosis as quick as possible. We do send out a lot of our lab work as well. Part of the reason we do that is to keep things as cost-effective as physically possible for you guys.
Cool.
So that's the lab area. And then our surgical area is actually back in here, tucked away.
Oh man, we're getting the real.
We have nothing to hide here. So again, this is cool. All basically, this is the surgery table here, surgery lights. This little machine right here does all of the monitoring that you ever think that you would need. That's your blood pressure, the amount of oxygen being consumed, the amount of CO2 being put back out, your EKG. Again, We use all the bells and whistles. We're not cutting any corners or anything like that. And I
Tell
see you
us this.
eyeballing my pink wall here.
Let's look at this.
This is my ode to my vet school, by the way, if you want to hashtag RUSVM. Love this right here. So when I went to vet school, every semester gets assigned a color. My particular semester, we were the pink semester, so hence the pink wall. And this was
How
our
about
saying in vet school, is only the strong survive. Between being overseas and how hard vet school is in general, we had a fairly high attrition rate. So again, we
and then let's talk about that for a second.
Yeah.
Don't be bashful here. Now, what is the attrition rate? What is vet school?
So it depends on the facility that you go to. That way. So Ross University, I ended up going there for a couple of reasons. One, University of Pennsylvania has extremely high standards, and they do not look at their stateside students any different than anybody else in the country. So if you're stateside with a little bit of a weaker GPA, not that my GPA was horrible by any stretch, it can be hard to get into my state school. Then when you go out of state, it can be very difficult or very expensive. Just the cost got out of control. And there's only about 28 AVMA stateside schools. So there's not even one school per state. I mean, it's less than that.
Yeah,
so you can just imagine how the numbers start to play out.
Yeah.
So then there's schools like Ross University. St. George's is also a great university. They're actually down in the Caribbean.
But out of 100 students that start veterinary school, how many finish?
Again, it depends on your school. We started with 125 and left with 85.
Yeah,
So
that's pretty intense there.
Yep.
Alrighty, where else
So
we
we're
got?
going to swing this way. That's just bathrooms and whatnot.
These are the callers for kind of like holding off on your Super Bowl munchies right there.
All right, here's our radiology suite that way. So you're probably very familiar with
like
this. This is a full CR system that we use. So basically what happens is that we have these discs that sit underneath this table here. We snap a shot, then we plop it into this little machine right here. We'll move this out of the way. Plop it into this machine, it reads the disc, creates a digital image, and then that's when I walk into the room with my iPad in hand, how I get that onto my iPad, basically.
Nice,
that way. And then this little machine right here, some of you may recognize this from going to your own dentist. This is our dental x-ray unit that way.
Yeah, more portable.
Again, we don't have the fancy 360 ones overall. It'd be nice if we did, but with how we have to do dentistry, that still works very nicely.
Yeah, absolutely.
So, all right, now we're going to slide towards the front here, kind of going backwards. We have two exam rooms here. They're set up pretty identically. Really, the goal between our exam rooms is that we were going for comfort. And that's really our goal. If our patients are comfortable, hopefully that makes our clients more comfortable. Yes, we're a hospital, but the idea is I didn't want that dry, sterile feeling either.
And by the way, I was going to say, you're located right at the intersection of 228 and Franklin. So that's really, really convenient here. Right next to the U-Haul.
Yes.
There's a U-Haul here. But that's one thing. I knew I had recognized your brand and everything, and that's why, because you guys are right in the center of 220 in Franklin. So pretty convenient there.
We're really trying to still get our name out there, who we are, what we do, that way. One of the things that I love to point out is actually right behind you is our exam table.
Sure.
One of my favorite things is this is my most expensive piece of wall art that I own. I hardly ever use this, actually. We get down on the floor with our patients. We have cat trees, so if I've got a cat all nestled up in a tree, I will do my exam right there. We don't disturb with them. We don't pick them up and put them onto the cold table or anything along those lines. So,
by the way, you got a couple hashtags from Amanda Slovak, RSVM11. So you got a shout out there.
And this is our other room here. Basically, what we've got going on.
Oh, say hi, Taylor. You got caught on camera there. Hey, look at this. We got a fireplace for the puppies and the kitties. That's pretty cool.
Same overall idea in here as well. Again, trying to go for comfort. Now, one thing is if you see all the cloth and the different things, people wonder, well, how do I clean? These rooms can be completely stripped down bare and completely cleaned if we do have something infectious come in. So again, when we designed everything and I picked different items that way, that was in mind the entire way through. So
fantastic.
Comfort, but also clean.
All right, let's close it out with our reception room here.
So welcome up front when you walk in.
We'll come around as if we're walking in here.
If you walk in, you can see here really what we're going for is, again, that continuation of that comfortable feeling. We have bright pops of color, we have wall art, we have a comfortable floor that's got grip, so most of my patients actually don't have much of an issue walking on this floor. We've got a comfort counter there with coffee, treats for both people and for humans. Nice, comfortable waiting room. TV's usually going. Again, nice, bright, open feel that way. Again, it's all about creating an environment that is very comfortable, both for our patients and for our clients.
Yeah, and I didn't quite get a picture of what Doc was saying. He's got the nice little treats for both patients and their parents. Yeah. So that's pretty cool.
Yeah.
Well, Doc, I really appreciate you taking the time and let us kind of get an inside peek in terms of your space and what you're all about here.
Yeah.
Like I said, before I came out, I looked you up online and all positive reviews there, and just it's pretty awesome having local. And you said you were graduated from Seneca and everything.
Yeah, exactly. Yeah, so I'm a local boy.
That's cool.
Graduated from Seneca in 2002, and actually from Slippery Rock University in 2007.
That's awesome. One of my favorite things about the Around Cranberry page is just meeting local entrepreneurs and business owners, and a lot of them, they are from around Cranberry, which is kind of the coolest part about it all. So
it's a growing area. It's a hot place to be right now, so I have no complaints.
Well, we have one final question from Bobby here. Is what's the scoop on the canine flu? What's the down low? What's the latest?
Oh, I'll lob that one up. So the canine flu. Here's kind of my spiel with this right now. The canine flu in Western Pennsylvania has yet to be diagnosed. It does not exist in this area yet. It will probably get here at some point in time. It has been diagnosed in the Columbus and Western Cleveland suburbs that way. There was one isolated case in the Philadelphia area, and it came as far from the south as like the Tennessee line kind of, but it never got here last summer/fall.
Gotcha.
The canine flu vaccine, this is kind of something that I think every person needs to take into consideration. The canine flu vaccine is very similar to the human flu vaccine. It does not stop transmission, and it does not stop clinical signs from developing. What it does do is it will decrease the severity of it. So when it gets to this area, it's probably not a bad idea for dogs that are going to be in high-risk scenarios, boarding facilities, and other situations like that. But it really, until it gets here, I don't see it as an unnecessary vaccine at the moment. Now, my tune will change when it gets here, but it's not here yet.
Gotcha.
On top of that. So, and it's a very expensive vaccine to boot as well. So, and it doesn't work unless you get 2 of them. You have to boost it. Otherwise, it doesn't work. So it's not just like a one-and-done vaccine, kind of like the Bordetella is that way.
Gotcha. No, I appreciate that myself. That's a great information. Well, hey, we're going to close it down here. I know Doc's probably got some patients coming in, and we have limited time. But any last words for everyone checking out the Windrose Animal Hospital, Doc?
Well, just check us out online. Like I said, we have a very heavy technologically footprint. If you're looking for something different, again, give us a look. We take our time. We answer our questions. We don't avoid the hot topics, food, vaccines, titers, anything else along those lines. Again, that's why I went to school, to have those conversations. And we all couple this with, generally, we do everything we can to control costs. Overall, we end up running about 30 to 50% less than a lot of our competitors in this area. So
that's impressive.
Keep that in mind.
Yeah.
Lastly, for any new client that is interested in jumping on board, we do offer $1 vaccines for new clients if they are looking for that. Or if you don't need vaccines or you're not really into that as much, we do offer $20 off a service for your first visit as well. So can't beat that. So please check us out online, check us out on Facebook that way, and we hope to see you here.
That's pretty incredible. Thanks so much, Doc, and thanks everybody for checking in and watching. And if you have, I'll switch this around real quick and say we'll sign off here with Doc. If you have if you know anyone that's in a similar business or owns their own business, we'd love to chat with them. I think this has been awesome.
Oh, this has been fantastic. Absolutely.
I've learned a lot from just being on the other side of the camera. And like I told you before, we have our own little Bella. She's a mixed breed that we need to bring in and get her fixed. So we'll probably be seeing you soon.
Fantastic.
And thanks again, everybody, for joining. And we'll see you next time.
It's a pleasure.
Bye-bye.